aspirin may raise the risk of heart failure. While many customers use aspirin on a daily basis to treat pain, a recent study undertaken by experts from the European Society of Cardiology examined many of the medication's hazards. According to their results, using aspirin on a daily basis may raise the chance of developing heart failure. Blerim Mujaj, the study's lead author and a professor of cardiology at Stanford University, says this is the first time aspirin use has been associated with an increased risk of heart failure in those having at least one risk factor for the illness. Though more research is needed, the data suggest that aspirin may have a role in heart failure. The researchers conducted the analysis using data from approximately 31,000 adults enrolled in the Heartomics in Aging (HOMAGE) database. The participants kept note of how often they used aspirin, and the researchers tracked them for almost 5 years to determine their health results. Participants' medical records were also examined, including possible risk factors for cardiovascular disease and drugs they were taking. The researchers discovered that 25% of participants were consistently using aspirin at the start of the trial, and over 1,300 patients suffered heart failure by the study's conclusion. In general, aspirin use was associated with a 26% increased risk of heart failure. After accounting for risk factors for heart failure such as high cholesterol, diabetes, obesity, smoking, cardiovascular disease, and high blood pressure, the researchers discovered that having at least one of these risk factors was also associated with a 26% increased chance of heart failure. The researchers anticipate that further study might be conducted in this area in the future to corroborate these results. These findings need confirmation in large international randomized trials of individuals at risk of heart failure, Dr. Mujaj stated. Until then, our data indicate that aspirin should be used cautiously in patients with heart failure or risk factors for the disease.